The government has looked at the pattern of infection and spread of the virus around the world, and the Chief Medical Officer, I'm told reliably, thinks that it is simply implausible that with the spread and transmission the way it's going, that this is not a global pandemic. The Australian government has lost confidence in the World Health Organization and decided not to wait for the formal declaration of a pandemic out of Geneva, but has gone ahead and implemented its own pandemic preparedness plan regardless.
Why has it lost faith in the World Health Organization?
You'll remember earlier, some weeks ago, when the World Health Organization was saying there was no need to ban travel or to prevent movements of people from and out of or through China, and the Australian government and the US government did so regardless. The judgment then and the judgment now is the same. That is that the World Health Organization is under tremendous pressure from Beijing and is having its judgments skewed by the pressure that they're under from China and the reliance that they have on the Chinese government for information and cooperation.
Do they have reliance on the Chinese government financially?
Yes, the Chinese government is one of the biggest contributors to the World Health Organization, and they're using their political power to affect its pronouncements according to Canberra. Now, it's not the first time that a great power has pressured a UN agency to bend to its will. The World Health Organization long delayed its pronouncement of AIDS as a global health pandemic in the 1980s because of pressure from the US.
But Australia, of course, is on UN committees where they would be at least listening to part of the conversation going on.
Well, there are Australians who are involved heavily and centrally at the World Health Organization. And you also have to imagine that all the countries involved with the World Health Organization and with emergency preparedness are all talking to each other as well. So there's a lot of comparing of notes and cross-talk going on. Everybody's talking about this as the biggest story in the world.
So to that point, you know, how much do we know and how transparent is China really being? They want to get praise for the way they've handled the outbreak of COVID-19, but is there more that we are not being told?
The way that the Chinese government's reporting of new cases and the spread and treatment of the virus has been so erratic and has gyrated so wildly that the international community doesn't have a lot of confidence in the rigour or the reliability of the Chinese figures. It's just all politics and not enough epidemiology. So that's why, I mean, they've changed the method by which they'll diagnose. It's just too erratic and too unreliable.
Mm-hmm. Scott Morrison's approach really contrasts with perhaps the way Donald Trump is managing the potential outbreak in the United States.
Well, Donald Trump has handed responsibility for this to his Vice President, Pence, which is, I guess, putting it at one remove from the President, whereas in the Australian case, Morrison is becoming more involved as this unfolds. So there is that contrast, yes.
And some would argue that, of course, the government was under pressure from the sports fraud scandal earlier today. There was a lot of pressure mounting on the Prime Minister. And, of course, that pressure is now gone with this new headline of Australia launching its preparedness for a pandemic.
Well, it's always tempting to look from the outside and find a conspiracy. This is one case where I think I can allay the fears. The National Security Committee of the Cabinet, which is the decision-making body on how to proceed with this virus and responses, met this morning. I'm told it was a very, very long meeting, that there was only one subject on the agenda. It was this virus. And that because of that, there wasn't enough time before question time to do what has become a daily or near daily press briefing that always involves at least the Health Minister, Greg Hunt, and one of the two chief medical officers and sometimes other ministers, including the Prime Minister. Instead, they did it after question time today, which made it later in the day. But it also gave the appearance for conspiracy theorists that Morrison was trying to find a distraction. That wasn't so. This decision was made in the morning.
Great to talk, Peter. Really interesting developments. Thank you.
Pleasure, Bev.